Coming up on Medwatch today, the story behind one man's disc replacement surgery, how it helped get rid of back and neck pain he thought would last forever. February is American Heart Month. We have information on new blood pressure guidelines you need to know about. And we'll take a closer look at how Community Medical Centers is getting ahead of workplace violence, a plan for safety, both for you and employees. Hi there, and thanks for joining us. I'm Julie Musgrave. Neck and back pain can be tough to live with. For one patient at Fresno Heart and Surgical Hospital, finding out the source of his pain had him feeling new thanks to new hardware. Kevin Bull spent 37 years in law enforcement.
Emotionally and everything.
It was a way of life until he got hurt on the job.
Fell really badly, and I apparently injured my back and neck probably at the same time. However, the neck was never addressed in my injury claim.
That was 2005. The pain got worse as the years went by.
My doctor advised me that I would know when surgery would be necessary, and I did. One day while working around the house, it actually felt like I was having a stroke. When I raised my arms above my head to do the chore that I was working on, it felt like someone pouring hot oil down my back.
Kevin was suffering from spinal stenosis of the cervical vertebrae. He also had lower back stenosis with herniated discs, painful injuries with symptoms a lot of patients experience, according to Kevin's doctor, Ali Najafi.
Common causes are when our discs degenerate and tear, and bulge, if you will, and putting pressure on the nerves. That gives you neck pain, headaches, pain radiating to arms, sometimes numbness and weakness. Depending of what level and how much nerve and spinal cord is compressed, patients may develop difficulty walking, hand numbness and weakness, problems with dexterity, in addition to pain.
Dr. Najafi says the neck area was Kevin's biggest problem. He recommended cervical total artificial disc replacement.
In this case, we went to the front of the neck. We removed bone spurs and discs and ligaments that are putting pressure on the nerves and the spinal cord. To do that, we need to take the pressure off the spinal canal and the nerves. So there is a decompression part of the operation that's necessary.
By replacing the disc, Kevin avoided having a fusion. That surgery can require 6 months to a year of time, allowing the discs to fuse. It can also be uncomfortable for the patient.
Versus in an artificial disc, you don't have to wait for anything. The disc starts, moving and functioning the next day after surgery. So these patients can move their neck in any shape, way, and form, and not need to be restricted.
I was a little apprehensive, to say the least.
Kevin had the surgery last October at Fresno Heart and Surgical Hospital.
The surgery in the neck wasn't painful at all. It was uncomfortable a small bit of the time, but as far as the pain, there was not any pain.
He says he was back up on his feet and walking around later that night. And still, a few months later, he says he feels like a new person and grateful for a doctor who pinpointed his pain and fixed it.
Yeah, I told Dr. Najafi, I said, you're a miracle worker.
The month of February marks American Heart Month, a time to raise awareness and educate for better heart health. Did you know stroke and cardiovascular disease is the #1 killer in both men and women nationwide? It's why keeping track of your blood pressure is so important. Dr. Teresa Daniele, the chief of cardiology at UCSF Fresno, explains new guidelines everyone should be monitoring.
Thank you so much for joining us. So today we're talking about these changes for blood pressure. What are those changes?
Well, thank you for having me today to talk about a very important topic in heart disease. We have, for ages, for years and years and years, we believe that the target heart blood pressure has been 140/80, and to keep those numbers below 140/80. In 2017, November, just a few months ago, the American Heart Association, American College of Cardiology, updated their old guidelines that were previously set in 2003 and stated that basically our new goal, our new definition of hypertension is really 130/80, so actually even more strict than previously thought.
So why are they making it more strict?
Because high blood pressure is the silent killer, and it continues to be the silent killer nationwide. And despite us treating hypertension, people continue to have strokes and people continue to have heart attacks. And the majority of patients, even though we treat them, the majority of patients, and it's believed up to 40%, will actually not be at goal despite being on medical treatment, which is a significant problem. So I do regard hypertension as a silent killer. You feel perfectly fine unless your numbers are significantly elevated, and at that time you'll start having headaches or blurred vision, difficulty thinking. But if the blood pressure is a little high, maybe 140s or 150s, oftentimes patients feel perfectly fine. And what happens is you have years and years of continued damage on absolutely every organ system in your body.
So how can people better monitor their own blood pressure?
Well, I think it's very important to know the guidelines and have proper screenings done by your physician at least once a year. And when the physician says your blood pressure is high, oftentimes, especially with the women population, they get very defensive. They say, well, I'm doing everything right. I'm exercising. I'm not eating a lot of salt. I don't know what else I could be doing. And what I tell patients is really having high blood pressure is part of the aging process. As your blood vessels start stiffening, eventually the blood pressure will increase. So much so that data shows on the old guidelines, 140/80, at least 80% of women over the age of 75 will actually be hypertensive. And so with the new guidelines, I'm sure that number is going to skyrocket. And it is believed that about 70 million people nationwide are can be classified as being hypertensive. The new guidelines, bringing it down to 130/80, will add another 30 million people to have the diagnosis of hypertension. Now remember, that's just diagnosis. They estimate an additional 4 million that will require medical therapy.
So definitely something that we need to keep an eye on.
Absolutely,
for sure.
absolutely.
Right. Doctor, thank you so much for your time. We appreciate it.
Appreciate it, and thank you for having me.
Coming up on Medwatch today, the first case of canine influenza reported in Fresno County. Advice for how to keep your pets healthy, just as you would yourself. Plus, our healthcare hero, the woman who leads the way in providing extended, compassionate care at Community Regional's Emergency Department, and how she tailors that care to each individual patient.